Hello, everybody. My name is Heather Butt, and I am the co-founder of a nonprofit by the name of Health for Youth. And we have the wonderful honor to present this Ubtech challenge for our friends at the New York City Football Club, Citc. So we're going to go ahead and present this to you. And then we're going to show you the challenge. The challenge is due tomorrow. So you're going to have to be a little zippy with it, but hopefully you can rise to the challenge, which I know all of you can. And then I will show you what I've come up with. And you can let me know what you think about it by emailing me. Okay, so before we start, so this presentation was created by the wonderful people at Ubtech, and Ubtech designs robots for schools and for businesses. So this is modified from their presentation, and we are very grateful to them for creating this challenge for all of you. First, you want to grab a pencil and a piece of paper, so you'll be ready to design your own robot and also to take some notes and make sure that you know what you need to do going forward. So these are just some examples of some Ubtech robots, and I do a lot of work with the New York City Football Club and their community program, Citc. So I've actually designed some robots as well. It's super fun, it's really enjoyable. By way of information, my background is actually in public health. So for those of you who may not know what that is, it's basically what we're living through now. So I went to school called Princeton University, and I got my history degree, and my focus was Afro-Am and African studies and American history and American studies. And after that, I went to law school. I went to a law school called St. John's University School of Law in Queens, and my focus was healthcare and law. And then I got my public health degree at a school called Harvard University, and I focused on law and public health. And that's basically things like quarantine laws and isolation laws and laws related to emergencies, as well as laws related to things like obesity and soda tax. But my real interest was in things like what happened right now with the COVID-19 emergency that we're dealing with. So that's what I actually studied in school. And then I got another degree in education so that I could actually teach young people such as yourself. And that's what I do now. So I teach, I'm a professor in college, and I teach about pandemics and epidemics and things like COVID-19. So it's a very interesting time for me. And so that's what I do. I also run this nonprofit called Health for Youth, and we work with young people to help them transition from high school to college, college to the real world. And we also do a lot of cool programming with them. And one of the coolest programs we do is with the New York City Football Club, where we have a weekly soccer program. And we also do various other projects with them, such as this. And we're working with our students right now to build robots. So it's really fun to be able to do this project, which you'll see in a minute, has a lot of synergy with what I do on a regular basis. So these are some examples of Ubtech robots. And the challenge is pretty expansive. So you can kind of do what you want. Sky's the limit a little bit. That's pretty exciting. Okay, so Robert H. is a product developer at Ubtech, and he led a webinar to help introduce the challenge to everybody. So we're gonna follow what he taught in the webinar and then let you have at it. So today's agenda is, first, you need to define what a robot is. Next, you need to design a robot. And then last, you need to start the challenge. So what is a robot? So a robot is a machine that can gather information, think, and act. But I guess you're probably asking yourself, well, how can a robot actually think? How can it act? And how can it gather information? So the way that a robot gathers information is through a sensor or a series of sensors. And basically, the way Ubtech describes it, and I love it, is the sensor or the sensors are basically the eyes of the robot. They're the thing that the robot uses, and we have lots of sensors as people, right? We see things, we feel things, we touch things. So think about a sensor as the eyes, the thing that actually allows the robot to gather and bring in information. Next, we have the control box. That's the brains of the robot. That's a thing that actually pulls it all together and allows the robot to know what to do with the information that the eyes have gathered. And then finally, we have the servo. That's the act part. That's basically the joints, the arms and legs, the things that actually allow the robot to do what it needs to do. So how to design a robot? So in order to design a robot, you're going to need 4 components. One is a thinking component. We talked about that a little bit. Second is a planning component. Third is a creating component. And fourth is a building. And by thinking, I mean now this is you thinking. So first the robot was thinking. Now you're going to have to think. So with respect to the challenge itself, there's lots of ways that you can do this. The challenge allows you to either create a sketch, that's what I did, and I'm not a great drawer, but I created a sketch that meets the tasks necessary. It also should help limit human contact between patients and doctors. So obviously this is of great interest to all of us because doctors and nurses and healthcare workers are on the front line right now. And so if we can create ways so that they can still interact with their patients, but do it in a healthy way, that's hugely helpful. How can you do this? You can try to use parts of the robot kit that hopefully you have if you're one of the New York City Football Club Citc participants. You can also use parts of other kits. You can use household objects, and you can draw. That's what I did. I just did it super basic. I do have access to robot kits, but I figured I would do a drawing. I knew I could do that. Like I said, not well. Don't expect a lot, but I did do a drawing. And I'll describe the drawing in more detail. All right, so the first part is you want to think and research. So these are some examples from Ubtech, everything from a monitoring robot to a disinfectant robot, a delivery robot, an exoskeleton robot. These are super cool. And again, would all be ways that healthcare providers could have a little physical distance between themselves and patients while still being able to effectively care for their patients. Step 2 is planning. So you're gonna have to think about all of these issues when you think about your robot. So sensors, remember we talked about that before, the eyes of the robot. So you could have a camera on your robot. That's a way that the robot could sense. Size, how big does your robot need to be? Does it need to be a certain height? Does it need to be able to reach things? Can it do that? Color, what color do you want the robot to be? And does that color make sense given what the robot needs to do? For training, the ideal situation would be that these could be rolled out pretty quickly. And so can healthcare professionals be quickly trained in your robot and utilize the robot pretty quickly? Function. The robot actually has to be able to execute the function correctly and do it in a way so that pretty much we can rely on the robot. So the robot needs to be able to do this pretty efficiently and pretty quickly. And cost. The robot can't be super expensive. You might want to create a $45 million robot. That's probably not going to work in this environment. Okay? All right. So take a couple of minutes and answer these questions to yourself. What will the robot do? How will it work? What will it look like? So put the video on pause, time yourself for 3 minutes, and try to answer these questions. And believe me, we're going to have more time to be able to actually figure this out, but give yourself 3 minutes, time yourself, and try to answer these questions. You know, if you have a parent that's going to help you, a guardian, great. So put this on pause for 3 minutes and then come back, okay? Okay, are you back? Great. So hopefully you were able to answer some of these questions in at least a little bit of detail. So this was an example that Ubtech came up with. And it's actually pretty cool. It's a Kitchener nurses station, which has mapping capability. It had a bunch of sonar sensors in order to prevent collisions, and a camera to identify patients, to serve meals, snacks, and so forth. And the reason why it's pretty neat is because the way Ubtech described it, essentially it would be given orders. Go to this room, take the tray there. And then as you can see from the example from the bed, it would take the tray and it would come back and it would go to the next room. That's a pretty cool example. And it still keeps the healthcare workers involved with their patients, but it also allows for a little bit less contact. So if you have questions, I'm going to give you my contact information in a moment. You're more than welcome to contact me. You need to submit your projects by April 10th. So take a picture or video of your labeled robot creation and tag Ubtech EDU or Ubtech EDU hashtag for a chance to win a robot. That's pretty cool. And you can ask a parent or a guardian for help with this. You can also check out Ubtech EDU for future challenges and webinars. And all right, so this is my idea. So my idea comes basically from an idea I had lots of years ago when I was working more in the hospital field. And I always thought it was interesting. And if you've ever been in a hospital, you know that when you get discharged, you've got some time on your hands. And so you're kind of sitting there waiting. And even when you're in the hospital, you got time on your hands. So you can watch TV, but, you know, it can be a little boring. So my thought was to have a robot that basically can come to your room periodically and kind of check on you. And it can be attached to a tablet of some sort. And there's some really great companies out there that are doing kind of similar work. And it could be attached to a tablet and basically come to your room, and you can hit on the tablet and it can give you periodic information about your status or let you know information about when you need reminders about when you're going to be getting medication and so forth. And then when you're about to get discharged, it can actually help with the discharge process. And then a link can connect to it so that once you're discharged, it can keep up with you and basically let you know what you need to do, what medication you need to take. So it can be almost sort of like a hospital buddy, so to speak. And you can go in and out of various rooms, similar to what you saw with the nurses station idea. And just periodically check on people. So it wouldn't supersede nurses and doctors, but it would be another resource to utilize, and then certainly could be a resource in terms of the discharge process for people. So that's my idea, and I actually plan to work on this even once the challenge is complete. And I'll be working on it with some of my Health for Youth students. So that's my idea. So hopefully you can use this and have your own ideas. My email is heather.butts@health4youths.org, health the number 4youths.org. Feel free to contact me with questions, and happy creating. Good luck, everybody.